Joining me now is the director of the National Institute of Allergy and Infectious Diseases. It's Dr. Anthony Fauci. Dr. Fauci, welcome back to Meet the Press.
Thank you.
Let me start with the issue of Omicron in this sense. On Friday, you suggested that it might be less severe. We've seen a new study out of the UK that seems to be perhaps sending a mixed signal. What can you share with us this morning on where Omicron is and how much of a threat it is?
Well, the one thing that's very clear, and there's no doubt about this, is its extraordinary capability of spreading, its transmissibility capability. It is just, raging through the world, really. And if you look even here in the United States, you have some regions that start off with a few percent of the isolates that are positive, now going up to 30, 40, in some places 50%. So yes, there is this issue of whether or not it is or more or less severe. The information we're getting from our South African colleagues still suggests that when you look at it totally, the hospitalization to case ratio is less than with Delta. There seems to be less durability of symptomatology, less requirement for oxygen. But you got to be careful. That might be due really to the fact that their population has so much experience with prior infections that it might be underlying immunity that's making it look like it's less severe. And as a virus, it inherently may not be less severe. No matter how you look at it, Chuck, when you have so many infections, even if it is less severe, that overcomes this slight to moderate diminution in severity, because our hospitals, if things look like they're looking now, in the next week or two, are going to be very stressed with people, because again, we have so many people in this country who are eligible to be vaccinated who have not yet been vaccinated, and that's going to be a real problem for stress on the hospital system.
Do we have the right protocols in place? Are we traveling? Do you believe the amount of travel that's going to take place in the next 2 weeks is reasonable considering the situation we're in, or should folks be rethinking their travel plans?
Well, I think people just need to be prudent. Clearly, when you travel, there is always a risk of increased infection. That just goes with respiratory illnesses. But if people need to travel and want to travel for the obvious family reasons during this holiday season, if you're vaccinated and you're boosted and you take care when you go into congregate settings like airports to make sure you continually wear your mask, you should be okay. But we are going to see breakthrough infections, Chuck. There's no doubt about that. The difference between a vaccinated and boosted person who has an infection and someone who has an infection who's never been vaccinated, a major difference with regard to the risk of severity.
Well, let's start. I want to go through a few of these scenarios because people are trying to figure out what should they do if something happens in their household. So you have a COVID positive breakthrough of a vaccinated person. How many times do they need to test negative before they should feel comfortable going back into society?
Well, the general rule is if it's about 7 to 10 days following the onset of symptoms, they're going to be okay. You want to get tested to show that, that's fine. But it really is duration from the time you initially get symptoms. That's one of the things that I think people need to understand. You want to quarantine yourself in the sense of isolating yourself from the rest of the family so you don't spread it around. But that's the general rule of thumb.
All right. What about if you're vaccinated, you don't have COVID, but you've been exposed to COVID? What is your responsibility? What is your recommendation?
No, if you are vaccinated and you're exposed, you don't need to isolate yourself. Some people, and I think it would be prudent to wind up getting tested. Testing now is so much more available, Chuck, than it was in the past, and we're going to be doing even better looking forward over the next few weeks to a month. So again, you don't need to isolate yourself or quarantine yourself for sure if you are vaccinated, but you might want to get a test a couple of days later to just make sure that you have not had a breakthrough infection if in fact you're vaccinated and hopefully boosted.
Well, you kind of answered my follow-up, which is because, look, we've seen this ourselves. Somebody tests negative, there's a positive in the house. Somebody tests negative, right? A brother or sister tests negative, and then the next day they test positive. So how many days from exposure should you feel comfortable that a negative test is truly a negative test?
Yeah, you want to wait at least 3 and up to 5 days following it. So you might want to get a couple of tests, test one at 3 to 5 days and maybe one a little bit later. The tests that are now available, the point-of-care antigen tests, are not as sensitive as the PCR test. But if you do them sequentially, 1 or 2 or more, you're going to get a result that would be an accurate result.
What should we expect from President Biden on Tuesday? I asked this question, what more can be done that you already haven't done in your mind?
Well, what you're going to hear from the president, I don't want to get ahead of the president, but he's going to stress several of the things and upscaling some of the things that we've been talking about. He came out with his winter plan, which is really a good plan, getting people boosted who are vaccinating, getting children vaccinating, making testing more available, having surge teams out because we know we're going to need them because there will be an increased demand on hospitalization, strengthening the safety of travel, and providing vaccines for the rest of the world so that we can look at this as a global problem, not only a problem here in the United States, because what happens globally certainly impacts us. But you're going to be hearing a bit more about that, and we're looking forward to the president's speech on Tuesday.
I'm curious on the issue of boosters. You and I have had a conversation multiple times in the last 4 months, and I've asked you multiple questions on boosters. Are we getting ahead of the science? Are we behind the science? You had President Biden at one point said, hey, we should probably do it after 5 months after talking to Israeli officials. There were some thoughts in August that it should be 8 months. There was confusion about 6 months, and it was, there's been a lot of ambiguity, if you will. Now, all of a sudden, Omicron is here, and there's no more ambiguity. But how much did this booster confusion set us back?
I don't think it set us back, Chuck. I mean, it became very clear that we said 6 months or more. After at least 6 months, go get boosted. If it's J&J, it's 2 months. I think those recommendations from the CDC were pretty clear. The one thing we want to make sure people understand right now is that when your time comes to get boosted, get boosted, because when you look at Omicron, all the data in Omicron indicate that even with the good protection that you get, certainly against severe disease from a 2-dose mRNA, when you look at what it does against Omicron, it's down considerably to a level where you really need to get boosted. If we're going to deal with Omicron successfully, vaccinated people need to get boosted. And obviously, people who are not vaccinated clearly need to get vaccinated now more than ever.
Well, let's talk about what the definition of a fully vaccinated is. Number one, should we expect that definition to change? I know that's not your decision. I assume that's a CDC decision. But let me ask you this. If you're advising a private company that does have a vaccine mandate or a vaccine requirement, would you tell them that they should make boosters part of the requirement?
I would tell them if they want their enterprise, their place of employment optimally protected, that you should get boosted. As you said, there is this technicality of a definition for requirement purposes. But if someone comes to me and says, what is the best thing that I could do? I would tell them to get people boosted. No doubt about that, particularly now in the environment of Omicron. The data are very clear, Chuck, about Omicron. It really needs to get boosted.
I'm curious, is there a lot to learn from all of the professional sports leagues about 2 issues? One, the issue of boosters, and 2, the issue of the J&J vaccine? Because I know now we're not really recommending it. And it does seem as if the J&J vaccine was very popular with athletes. And here we are there. And I know they get tested more than most of the rest of the population. Is that why it's been so many breakthrough cases?
That is possible. There's no doubt now as we get more and more data that when you look at the data in general, that the mRNA are preferable to the J&J. The reason the CDC made that recommendation very explicit was not only the degree of efficacy, Chuck, it was the risk of getting thrombosis with thrombocytopenia, that blood clotting issue that generally women who are between a certain age get it. So it isn't seen very often in men, almost exclusively, not exclusively, but almost exclusively in women. So when you put together the two things, the risk of the blood clot and the less of an efficacy when you compare them head to head, that's why the CDC came out clearly that it's preferable to get an mRNA.
Is it, how likely is it that Omicron will replace Delta, the way Delta replaced Alpha? Or are we really going to have two of these variants circulating simultaneously?
You know, we don't know yet, Chuck, for sure. You have to see how it rolls out. But if you look at what's happening, what happened in South Africa, what's happening in the UK, and what's beginning to happen now, I would not be surprised if Omicron bumped Delta off the table. Because, for example, in certain regions in the country, there's up to 50% of the isolates are Omicron. That's a doubling time of anywhere from 2 to 3 days. And when you have a doubling time that's short a period, pretty soon that isolate is going to take over.
I want to ask you to react to one thing. The vice president said in an interview on Friday, "We didn't see Delta coming. I think most scientists did not, upon whose advice and direction we have relied. Didn't see Delta coming. We didn't see Omicron coming. And that's the nature of what this awful virus has been, which, as it turns out, has mutations and variants." Dr. Fauci, perhaps nobody could have seen the specific of Delta or Omicron, but did you not see variants coming, or did you?
Yeah, I did. And I think that the vice president's statement was taken a bit out of context. I believe she was referring to the fact that the extraordinary number of mutations and amino acid substitutions, particularly with Omicron, no one had expected it that much. But we were well prepared and expected that we were going to see variants. There's no doubt about that. But I believe that the vice president was referring to the fact, if you look at the number of mutations in Omicron, it's unprecedented. There are about 50 of them, 30 of them in the spike protein, and about 10 to 12 of them on the receptor binding domain. We've never seen anything like that before. So in that context, she was correct.
All right. Dr. Anthony Fauci, I'll admit I have like 17,000 other questions, but we don't have that much time. I'm sure we'll be seeing you in the days to come. Appreciate you coming on and sharing your expertise.
Thank you, Chuck. Good to be with you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.